Okay, we're back with the same patient who woke up with a stiff neck, what we call a kink in the neck, non-medical term, but she has a lot of stiffness in the muscle called the upper trapezius. So if you watch her, look over her right shoulder, pretty restricted. Is that uncomfortable there?
Yeah.
And then turn to the left. As you can see, she can turn, probably tough from the camera angle, but she can turn much better to the left, okay? So since she woke up with it, it's pretty, what we call acute. So I'm not gonna be too aggressive, but my focus would be to do some soft tissue work on this upper trapezius with a mild to moderate pressure. It's not real firm pressure. She's very stiff through there. When I press with my thumb, it feels very firm. It feels what we call spasm. And the other term we use is a trigger point. So this is a common area to get trigger point. And the main reason patients wake up with this is they just slept awkward during the night. So if they had their head in an awkward position and they laid there for several hours and they wake up and it's very stiff and very painful, that's really how she presented today. So I'm just going to hold some pressure there for about 10 seconds. And she'll tell you that the pain does radiate too. It can go up into the forehead, it can go into like the eyeball area, it can go down into the arm a little bit, and that's a pretty typical response. Right there?
Yeah. I feel it here.
Yeah, she's saying it radiates up into her forehead on her right side, again, which is a pretty common scenario. And I'll just have her do some gentle turning to the right. Okay, don't go into the pain, just kind of right up against the pain. Because it is key to try to maintain some motion when you have a kink in the neck. You don't want to just hold your neck stiff all day, but you don't want to force it. So I just have the patient do some gentle range throughout the day, especially if you sit at a desk for hours. Every 30 minutes, do about 10 repetitions of gently turning the head. And so I would see her, obviously today, and I'd probably bring her back into the clinic at the end of the week or early next week. We don't want to have her do any aggressive stretching. Right now it's mainly icing, gentle range of motion. Some patients will reach for the Advil or the Tylenol as well if it's bad enough. So again, this is a soft tissue mobilization technique, trigger point release for the levator scapula and upper trapezius muscle on the right hand side. So I'm going to do a little bit more pressure. And the muscle, the levator scapula muscle goes from the scapula, which is the shoulder blade, up to the base of the neck here. So it kind of runs right through here. And then of course the upper trapezius is this thicker muscle that kind of runs close to it. So the so-called kink in the neck usually involves those two muscles. Okay, now I'm going to have her look down and to the left a little bit. Just to elongate the muscle a little bit, not really stretch it, but just get some motion in there. And as she's looking down and to the left, I'm applying a little pressure to it. You okay?
Mm-hmm.
She's loving this right now. One more. Okay, and that's it.